Hello, everyone, and welcome to our session from 2022 North Country Leadership Summit, Optimizing Healthcare, Community Collaboration, and Workforce Resiliency. Just want to give a quick shout out to all of our sponsors for this year's event. Without their support, we cannot have such a successful event each year, and so we appreciate them helping us make this a reality. And just a few housekeeping items for today's session. Please place all of your questions and comments in the chat, and our staff will make sure that your questions are addressed during the Q&A portion of the session. If I see it on as you come on, please make sure that you remain muted with your video off for the presentation. And all presentations will be recorded and archived on both the AHI YouTube page as well as the North Country Leadership Summit webpage, available at the link here. With that, I'm going to turn it over to Josh. Josh Stefani is our presenter for today. So Josh, go ahead and take it away.
Great. Thank you, Sarah. And we can all see that, correct? I have the Mac world where I can't see anything on my end. Great. So my name is Josh Stephani. I'm the Food and Farm Hub Manager at Comfort Food Community based in Washington County, but operating out of the Southern Adirondack region of Washington, Warren, and Saratoga. Additionally, I'm an adjunct instructor in environmental studies at SUNY Potsdam, and I'm also on the steering committee for the Adirondack Food System Network, which is a collaborative effort of 12 organizations looking at and evaluating food insecurity across the entirety of the Adirondack region. So I'll be talking a bit today, I should say, about food and health and how we can leverage partnerships to expand food access and create healthy communities. A lot of the work we're focused on doing at Comfort Food is specifically related to this dynamic of food access and health. So a few goals and objectives of this presentation. One is to understand the linkages, as I said, between health outcomes and food insecurity. We do a lot of work with chronic illness that are specifically related to diet. So really looking at those and making sure we understand the connections between food and health. Outlining some local and regional efforts that we are doing, but also at the same time, other organizations throughout the region are doing and collaborating across these sectors. And lastly, just exploring potential opportunities to kind of redefine and reframe healthcare and emergency food assistance by messing with this idea of public space and food access. Like I said, by no means are we the only ones engaged in some of this work, but that being said, there's a lot of great activity happening within this region addressed at this food as medicine concept, this idea of food as health. We're just a small part within this. Oops. So a little bit about Comfort Food Community if you're unfamiliar. So as I said, we're a food access organization based in Washington County. However, we serve Warren and Saratoga counties as well. We have three main program areas around food access, food recovery, and food as health. So food access being increasing the ability for communities, households, and individuals to have the necessary ingredients, for lack of a better word, for a healthy meal. Food recovery, working and partnering with local producers to glean their excess and redistribute it to not only pantries, but other opportunities that we may find ourselves, such as senior living facilities, and increasing that access there. And then food is health, which is the primary focus here. Lastly, our main focus up until now has been really around emergency food programs and prescriptive models of food distribution. By that, I mean we're solely focused until recent years on providing the basic necessities to our community. That being said, over the last few years, we've moved in this direction of looking at more of a holistic and prescriptive model of food distribution and working with some of our partners to do that. So to kind of begin and help frame this conversation of where we're headed and what are some of the theoretical underpinnings of the food as health model, I want to play with a few basic understanding so we're all on the same page. So the first is the social determinants of health. So looking at the specific drivers that go beyond healthcare in clinical settings that contribute to someone's positive or negative consequences within their diet and within their overall well-being. So looking at how specifically food insecurity has impacted depression, mental health, and suicide. And these are all extremely well documented in literature. And I'm not going to rehash some of the findings of a lot of articles, and as well as some governmental and non-governmental agencies working on these issues. There's long-term effects related to food insecurity from a young age well into adulthood, as well as what we're dealing with now, a lot of diet-related issues, especially within Washington County, but also in the region. And we'll primarily be focusing on obesity, heart disease, hypertension, and diabetes. That being said, our model really looks at this idea of accessing fruits and vegetables to improve health outcomes. And with that comes a lot of loaded terminology, loaded nuance to make this happen and make this a viable option for ourselves as well as our community. So if we look, taking one more step further, looking at this larger conception of food insecurity in the United States, right? The USDA has defined it as having access at all times to enough food for an active and healthy lifestyle. This is really important as it's really solely focused on food insecurity, is solely focused on the idea of food access. It's also coming from the USDA, which is an interesting of itself, is the main government agency on the federal level responsible for dealing with health as well as social welfare programs such as SNAP and WIC. So right now, in the United States, or as of 2021, I should say, the food insecure household is about 10%. So a tenth of the US population is considered food insecure. And within that 10%, they have a further breakout of food insecure as well as very low security when it comes to food. So they do break it out further. That being said, it's solely focused on a household level of food insecurity. And there's a growing concern around older adults and children. So we're seeing a lot through the USDA and other programs focused on addressing the food insecurity concerns for the older populations. A lot of individuals, as we see within our region, are at a fixed income, at a senior living facility, or in a community where they're limited in their access to a large variety of goods and services. That being said, on the other end of the spectrum, households with children are at this time facing significantly higher levels of food insecurity for those households who are not with children. So, like I said, the USDA is the primary one of their primary focuses within the USDA is to focus on food assistance programs and looking at this question of food insecurity. So they're the ones really defining what food insecurity looks like. So taking a little bit more of a microscope lens on is to look at our region. So 14 to 15% of food insecurity among households in Washington and Warren counties. Saratoga County is a little bit less, or hovering around that actual national average, around 10%. We're seeing significant difficulties with transportation, limited access to grocery stores or health clinics. Individuals have to travel quite a distance. They rely on social capital. They rely on their friends giving them rides to any of the public spaces that they would need to access just to survive, especially within Washington County, as there's 5 grocery stores and they're around the rim of the county. But even more so as you get up farther north, transportation becomes a more challenge throughout the winter season as well as the summer. We're also facing an aging population. We're seeing a lot of population centers becoming older, and those individuals aren't moving away or moving towards resources. They're staying in their communities. And additionally, there's a limited access of SNAP and WIC vendors. What I mean by that is there are throughout the pandemic, actually, there was a decrease in the number of vendors that were accepting SNAP and WIC throughout the county as businesses were closing. That being said, for someone on a fixed income who receives this benefit, it's very difficult to find a vendor other than a Dollar Tree or a Stewart's that offers appropriate food to feed their families. But at the same time, I would be remiss to recognize that of these deficits, there's a significant asset within our county, and that is the agricultural production. Our farmers are able to produce not only fruits and vegetables, but also dairy and meat vendors across the three county region. So if we peel back a little bit of the layers, why food insecurity is a concern in this conversation around the social determinants of health, right? So the social determinants of health, as many of you are probably aware, really focus on the additional aspects of healthcare that contribute to someone's well-being. So the rising costs of transportation and food during the beginning in 2020 with the pandemic and moving into the rising cost of not only fuel as the supply chain issues, we're seeing significant increase in the cost of transportation as well as food. So individuals are struggling to make ends meet, let alone provide for the basic necessities they would need to keep their households going. So the decisions additionally are changing by heads of a household. So when we look at the question of food insecurity on a USDA level, they're solely focused on the question of income versus the flexible spending, as well as eliciting those responses based on an either or situation and not necessarily factoring in those decisions made by a head of household to allocate money for food rather than medication. As I was preparing for this presentation about a month ago, I had a conversation with one of our clients who I worked with for a few years, and it was really around this idea of struggling to make ends meet and having to allocate money just to buy food as opposed to allocating for the necessary medications for her and her husband who've had chronic illnesses for the last few years. So that is a decision that's been constantly being changed, and we're seeing that as it impacts our ability and our community's ability to serve, our ability to serve our community through fresh access to food. There's also this issue of accessing a variety of food. So we've seen, as the supply chain has impacted this, the ability for folks to access necessary staples as well as fresh and local products is constantly changing. We're seeing things disappearing from the shelves, the consistency around those, as well as a lot of our communities' specific cultural or social needs related to their foods. And lastly, there's this difficulty meeting dietary needs. Again, the USDA definition of food insecurity focuses on sole access to this food. There's this idea of nutritional insecurity, where it's one thing to have access to a grocery store, but it's enough. It's a different matter entirely to be able to purchase the necessary nutritional aspects that are offered at those grocery stores. That being said, food insecurity rates are remaining relatively consistent. It's hovered around 10% for the last about 2 decades. That being said, we're faced with this rise in diet-related illnesses, and we're seeing the consistent concern for these main chronic illnesses. So taking a look at chronic illness and diets, again, so the United States specifically we're focusing on here. So 42% of American adults, and this is from 2 years ago, are considered obese. And we have nearly 50% of adults in the United States will also experience a heart-related illness sometime during their life. Diabetes, estimated with 12%, 38% are considered pre-diabetic. And as individuals are getting older, those risks increase. And lastly, hypertension, where estimated about, again, half the US population is experiencing hypertension. There's 2 things that really make this a concern as we're talking about food insecurity. One is that 60% of Medicare and Medicaid expense is related directly to these diseases, right? Roughly, that's about $400 billion on an annual basis is allocated by the US government toward dealing with these 4 major chronic illnesses that are all food related. And lastly, with 2+ years of the pandemic under our belt, COVID and the effects are adversely exacerbating these diseases as well. So this conversation around food insecurity and health is extremely important as we're approaching what we can do and how we can challenge the system. So taking a little bit look, this is one of my favorite diagrams that looks at the hunger and socioeconomic disparities in chronic disease. And it really hits home on this notion of cost benefit analysis, is, if you will, in financing, or this spending trade-offs. This endless cycle of someone experiencing food insecurity is exacerbated by other issues, whether it be stress, whether it be healthcare, whether it become those trade-offs and those decisions by heads of households allocating money for food rather than medication, or allocating money for transportation just to get to work to make more money to allocate away from food and the necessary items they may need. So at CFC, we pride ourselves on different models. We also want to think about where we're coming from. So our primary goal when we first started a few years ago was looking at this traditional pantry model, right? So donation-based, non-perishable products, subject to excess, and food only, right? So this idea that the products offered at pantries are solely based on what is available through the food bank or what is available through the basket at the library that's been given to the fundraising. And that at times, what has been made available to the food bank are pallets of products that grocery stores cannot sell, which are often laden with preservatives, high calorie counts, high sugar, and salt contents as well. All right, so we're coming from that model, and we're seeing that not just in our region, but across the United States, as well as this traditional healthcare model, right? So prescriptive, we're offering medications to treat some form of symptom related to a disease, and not looking at necessarily the holistic picture, looking at how diet can change or alter someone's well-being. That being said, the caveat: in no way am I advocating for getting rid of medicine or prescriptions at all, right? Just recognizing the role in which food plays in our diet. So where we stand, right? So increasing diet-related illnesses. We saw the numbers on hypertension, obesity, diabetes, right? We're seeing this nutritional deficit within our region, but also our nation. We're also seeing rising costs associated with inflation and costs related to transportation and simple access of food that we need. And in rural communities like our region, like the Adirondacks, a lot of our resources are allocated to larger population centers, which unfortunately a lot of our older adults don't necessarily live in those situations, as well as communities that are far away, right? So if we look at our region, we have the Saratoga to Glens Falls stretch of resources, and then other communities outside of that. It's often a time consuming endeavor and a labor and stressful endeavor just to get to some of those resources for folks who are experiencing food insecurity. So where we are going. So, the model I'm going to present is focused on this client-centered, holistic approach. So breaking barriers related to food access and not looking at solely as food access and healthcare as silos within this conversation. And kind of disrupting this idea of when you enter a food pantry or enter a specific space that it's either food-centered or health-centered, and combining those approaches, really playing with this idea of public space as a potential opportunity to connect individuals to resources as well as food. So exploring these linkages, these are the 5 areas that I want to hit today. It's changing this emergency food distribution, right? Rethinking how we traditionally help our community members through emergency food, such as pantries, looking at public spaces as an opportunity to engage the public and redefine what it means to receive food assistance, looking at collaboration, looking at the organizations we're working with, reshaping the food access conversation, redefining what that even means, and lastly, education and broader resource connection, uh, which our food center model really prides itself on our ability to link our clients and our guests with broader resources. And lastly, the one takeaway, if you take away nothing else from this presentation, is that this topic is larger than food or healthcare, and it's really a blend of these combination. It's a blend of these two terms and these two topics, as well as a conversation around transportation and access. And it goes well beyond the food on your plate or the doctor visit. So changing emergency food distribution, right? So this idea of incentivizing client choice, right? This is no longer an opportunity to just give what we have in excess, but really how we can provide supplemental assistance to our folks visiting our community center and providing them with local and fresh products as opposed to just dry non-perishables. We've been lucky in New York State to receive Nourish New York funding for food banks and food pantries to actually incentivize purchasing of those local products and really building our network and our ability to help serve our farming community and not leaving them with the expectation of solely donating, but able to compensate them for their hard labor. Reframing the space. So thinking about how when someone enters our facility, interacts with our staff or volunteers, we're driving our community approach. We're putting the person and the family centric and offering them the resources they might need. We're also asking them some of the hard questions, right? So understanding that food insecurity is often and most of the time really connected to another need, whether it be transportation or jobs or housing. There's often something else that needs to be addressed at the same time. And lastly, reducing this vulnerability. It's extremely vulnerable for an individual to go to a food pantry. There's no way around it. But that being said, if it's a center and a space where someone is involved and wants to be and can meet their community members and have a cup of coffee and a snack, that's a game changer. Also, as I mentioned, offering resources, not just solely food, but connections to services throughout the county. And as I mentioned, as needs grow, the community grows. That being said, there's often a lot more needs identified once we get to the root of the problem and have the conversation with those individuals. So leveraging public spaces. For a long time, we have this idea of going to a food pantry to receive assistance and fresh food, but at CFC we tend to pride ourselves on kind of this place-based service. So whether it be at a library or senior living facilities, we have a handful of partner CBOs that we work with that are doing. They're not necessarily doing pantry things, but we can provide them with food to distribute to their clients or clinics, and looking at health centers as an opportunity. So really reducing those barriers to incentivize local food options such as farmers markets, promoting programs, limiting the barriers, not only the perceived but actual barriers for individuals attending and spending their benefits at farmers markets to access those products as well. So collaboration across sectors, really a lot of our work is built on relationships between, in primarily looking at this food as health conversation, healthcare providers and payers, broadening this idea of what it means to receive healthcare. So an individual could attend a clinic and walk away with, a medically tailored CSA box, for example, or that their health insurance company could pay for their help their help their ability to purchase local products at a farmer's market, for example. So we also, recognize that organizations and communities can't necessarily do it alone. And so looking at opportunities to collaborate and learn from one another, but also build off work. So, shameless plug for the Adirondack Food System Network. This idea of working through organizational challenges to meet their communities around food. Uh, Additionally, reducing the barriers to accessing resources, right? So connecting clients to agencies, we've identified and worked with a lot of individuals who over the course of years at this point, and I've worked with clients, my longest case was over 10 months, just connecting the dots, everything from finding housing to a new job and a new nursing certificate, right? So connect, but that being said, a lot of our clients don't know what resources are available to them. And maybe they do, but we can serve that role of not only offering food, but also resources. And lastly, just reducing the barrier of client choice models, right? So a lot of folks receive um, boxes of food at pantries, but they're not necessarily using those products. So if we can reshape of how a distribution at a food pantry offers and increases cultural appropriate meals, how it increases individuals' ability to supplement their budget for food. That being said, we also do a lot of work within the community to just give away fresh products at those public spaces. So those are built on collaboration, whether it be collaboration around transportation opportunities or simply visiting the doctor. So reshaping the conversation. So as I mentioned, blending this blending the resource navigation with food access and messing around with this idea of when you go to a food pantry to ask for help, you're also walking away with other resources as well as the community that has your back. The cultural and individual centric food access. So we in Washington County have a vast county, but it's quickly changing demographically. It's an older population, but we're seeing an influx of various communities, and meeting those communities with information and resources as well as food to help meet their needs. And lastly, I always talk about this conversation around how we can better serve our older individuals within our communities. And I give the example of a butternut squash. It's one thing to give a butternut squash to an individual, which is a huge squash, anywhere from 4 to 8 pounds. And someone who's on a fixed income, living by themselves in Hudson Falls or Glens Falls, they're older, they don't really cook for themselves. That's more of a burden and more stress given to the ability to use that entirety of the squash. Perhaps you have dexterity issues. Perhaps we can mess with this idea of how we're distributing food to make it more individual and culturally sensitive to someone's needs. And lastly, education on produce availability and kind of using this information and this plethora of agricultural business and producers within our region to help our communities address this question of food and nutrition deficits. So I always like to incentivize the unusual produce, or the clients I've worked with, the weird produce, and that has been something that they have come to love about a lot of our programs, is that time we're advocating kohlrabi. They may hate it, but they're willing to try it because they built up this social capital. And they may try it because they recognize the health benefits. They may get their grandchildren to try it as well. So it becomes more uh, of a community event, a family event to try these products. And lastly, this wraparound services, connections to community members. We're not solely seen as simply providing food for yourselves and your communities, but rather this idea around what more can we help you with? What resources are available for your success and your household success? Some takeaways before I wrap it up. As I said, so diet-related illness is increasing. Food insecurity is relatively staying the same when you look at the numbers, but you peel back those layers. There's a lot more to it. Food insecurity, manifests itself related to other needs and other services, whether it be transportation or health as well. And how can we address those? There's a role for healthcare within food access and vice versa. The idea that you could go to a doctor's clinic or a health clinic and walk away with fresh produce, and the buy-in from the clinical staff and promoting that as an opportunity, or the prescription that is a CSA as opposed to medicine, or maybe in conjunction with that, right? That's a game changer. And not only that, it helps individuals lift some of the burden for accessing these foods. And most importantly, this conversation is more than just food, and it's more than healthcare. It's a collection and peeling back the layers of an onion, if I can use one food pun, that we're faced with. And so it's a collaborative effort. And as we approach some of these different models, as we approach these, the main goal is to serve our community, both our community in need, our farming community, but also how we can improve food access and address this larger enigma of food insecurity. So I'm happy to take some questions after this. This is my information. I'm happy to talk offline, or I know we'll have a little time for questions and answers of what we're doing. I recognized a lot of names in the participant list, so you're probably familiar with CFC. But that being said, feel free to reach out, or I turn it over to Sarah for questions, I believe.
Yes. So, thank you so much. I love listening to you talk about food and how it changes so many aspects, not just providing food, but how it can change so many other aspects of life for our community. So I appreciate that. I have one comment in the chat so far from Sue just saying, great to have you at the Hidden Gems Resource Fair that we had last week. I also agree, Sue. We were having a conversation before this about all the food that he provided and how we have enjoyed a lot of it so far. Does anybody have any questions so far? Any comments? And again, like Josh mentioned, his email, you can always reach out to Josh after this conversation and kind of have an offline conversation as well, something specific to you guys, if that's what you'd like. I'll give it a minute for people to put a question in. See. And Josh, we'll definitely have to connect for next year because I love listening to you talk about this, and it always makes me want to do more work. I'm not seeing anything come through. Oh, as I say that, something comes through. So I like the statement that food insecurity manifests in conjunction with other needs. What are the other needs you've observed that are common, and does it happen based on communities?
Like I said, so some of the main needs, specifically within our region, so Washington County's um, interesting because a lot of our options, we have a lot of rural communities. So we've seen a lot of issues around transportation. By far is an extremely big issue for a lot of folks. There's no public transportation across the county outside of kind of that Saratoga Glens Falls stretch. So for an individual trying to get to a grocery store, it's often difficult. That being said, the labor issue is added to the transportation. The opportunities for individuals in the labor market is difficult for folks to attend, and also housing. There's not a lot of options for someone on a fixed income in this environment because it is so extreme in terms of the distance covered and the ability to meet resources, or the ability to have a job in one of these centers. So those are some big ones that come to the top of my mind. But that being said, there's also some specific ones we work in, this idea of healthcare, where we see a lot of folks who don't necessarily have access to a primary, or are dealing with some health issues related to it, and they're limited on their fixed income, or don't have enough generated to it, and they hesitate to see a doctor based on that. The needs of insurance for a lot of our clients is also a big one. That being said, it is respective, and I'm sure if I asked one of my partner organizations to the north, it might be a different answer. I have a feeling transportation will be a common one that we all kind of face. and also looking at more urban environments like the capital district potentially. Transportation would still be an issue, but just manifest in a different way. The time that it takes to take, the CDTA from, Albany to Troy or vice versa. So I hope that answers the question. There's a lot in there. There's a lot in terms of the needs of our community, but also needs that I'm seeing reflected and heard um, by other organizations in the region.
Perfect. Thank you. I have two other questions that have come in. Um, did you want to discuss? Oh, I think that did answer the question. So we got to thank you. Do you want to discuss in greater detail the farm to school or the farm to library programs? Had some questions on that.
Sure, I'm happy to talk about our programs ad nauseum. So, yeah, so farm to school is a relatively new concept for um, food access and food insecurity. So, looking at those models, it's really about helping schools reduce some of their barriers to access New York product. New York is also great in terms of promoting the local products and New York State products as they incentivize financially schools to partake in that. That being said, there's a lot of barriers for schools hitting that number. Order minimums, storage capacities, and need. So that is a movement that's really taken on over the last few years as New York looks to promote school districts to hit 30% of their lunches to be New York product. That includes the ingredients as well as the more value added items. That being said, the farm to library program is, I think, one of our more popular programs, and so that's simply partnering with local libraries to provide a fridge and food on a weekly basis to any library that is willing to participate. Based on funding, but also as we're uh, growing that program, looking for opportunities for partner libraries. So right now we have 11 libraries across 3 counties that participate um, in the program, and so we're looking to expand that, and we have some partner libraries ready to go. Yeah, and it's an opportunity. You go to check out. Right, I live in a small town that has one of our libraries is in, and I go to the library to get my books, and I see fridge of fresh product that anybody can take. And that also kind of gets at that reducing that vulnerable aspect of food assistance.
Perfect. Thank you. The other question that I got was they're looking if you had any other ways the comfort food community is looking to reach the community. Are you doing any other programs? Are you planning things? If you want to plan something, ARHN's interested.
Yes, always to that. Right now, we're in a very interesting place. We just established our farm and food hub, which is my primary role right now, is looking at how that model of food distribution serves the wider region. So we're looking at different models from looking at mobile markets to opportunities to expand our existing programs to partner up with local pantries or health centers, grow our um, and this last year we already have grown some of our programs from the farm to library. Our fresh food pharmacy program in partnership with Hudson Headwaters has grown to distribute more into more health centers. Our farmers market promotion program has also grown to 2 markets, not just one. And so we're always looking at opportunities to kind of solidify some of those programs, but also we love to play with pilots and potential opportunities and looking at how we can further this food is health question.
Great. Thank you. Um, I have one more. Is there any effort to recycle food from restaurants and grocery stores instead of throwing it away? I love that question.
Yes, is the answer. That's an easy answer. So in New York State, beginning in 2023, we'll have a food waste law that goes into effect that determines how grocery stores distribute still edible product. There's a ranking system. So food pantries, if not food pantries, it's beyond edible. Then it goes to the farmers for compost. That being said, we partner up with local grocery stores in the region, Hannaford in particular, to distribute that. And we are we do work with a lot with the regional food bank to broaden what that means in terms of where we're picking up from and what that means. So a part of our food center itself offers these products. That being said, there are limitations at times from, in particular, the food that is especially ready pre-made. There are limitations on what can actually be distributed by food pantries set at a national level by the FDA and USDA, and it has to do with the nutritional labeling, and so that always generally has to be a product. So it's right now a little bit more difficult for restaurants to partake in that, but there are some great partnerships in the region that I can think of that really go toward that ready-made meal, and food pantries or emergency food are partnering up with ready-made items.
That's awesome. I always wonder how that works. So it's a great question, Peter. Thank you. Does anybody else have any more questions? I'm sure everyone wants to pick your brain separately, like I always do, Josh. Yeah, I don't know about anybody else, but these presentations from Josh always make me hungry. Every time, make me want to get involved, make me want to do all this work. I love listening to you speak about food. My sole mission is just to learn more about how to work with food insecurity and also just come visit you at all your events so I can get some food. I love it. I'm not seeing anything come through, so I guess we will close up for today. Thank you so much for presenting. This was fantastic. As always, if you guys have any questions, it's josh@comfortfoodcommunity.org. And you can reach out to Josh for further information. This presentation is recorded and archived, so you guys will have that information as well. And we hope to see you guys on our next session. Thank you so much. Thanks,
Thank you all.
Josh.